5-Minute Pearls for Clinical Practice. Today we are discussing the third in a series of 3 podcast episodes about the most important attitudes to have in clinical practice. This one is called positivity. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. This week's Pearl is called Positivity. This is the third in a series of 3 podcast episodes where we have been discussing what I consider to be the 3 most important attitudes to have in clinical practice. If you haven't listened to the last 2 episodes, I really encourage you to go back and listen to episode 13 and episode 14, where we discussed patience and perseverance. The first attitude that we discussed was perseverance, meaning that we remain steady in a course of action and purpose in spite of difficulties and obstacles. We need to continue to believe and work to improve the health of each of our patients, even when they don't always follow our instructions and don't take the best care of themselves. The second attitude was patience, meaning that we accept and tolerate delays, troubles, and difficulties without getting too angry or upset or frustrated. When our patients don't follow our recommendations to take good care of themselves or follow some of our treatment recommendations, we understand that change takes time, and this means having tremendous patience with the people with which we work. People sometimes take a long time to change their habits and consider following our recommendations, so having both the patience and the perseverance to stay on message and stay connected and engaged with our patients is paramount to successful clinical practice. Now, let's discuss what I consider to be the third attitude for us to have in clinical practice, and this is the core character trait necessary to having patience and perseverance. This character trait underlies patience and perseverance. If we don't have this attitude, then there's no way to have patience and perseverance. This is called positivity. The world is full of pessimism and tragic news, and it is so important for our patients to see us as people who will focus on the glass being half full rather than half empty. It is so important for us to be a shining light of positivity and optimism for our patients, even when they continue to practice suboptimal habits like smoking or drinking in excess or not practicing any other habit that we might have recommended. We can't give up on our patients. Rather, we need to continue to show faith in them that they will succeed eventually, even if they haven't succeeded in the past. Being a healthcare provider is grueling at times. We work long hours. We dedicate a lot of our time and energy to our patients, and I see a lot of professionals becoming burnt out over time. When this happens, we can become downbeat and pessimistic, and this attitude shift can rub off on our patients. No matter how challenging our lives become, and no matter how much other people may frustrate us, it is critical that we remain optimistic and positive with a sunny disposition when we meet with patients. I can't stress the importance of this enough. Attitudes are contagious in some ways. When we are around angry people, it is very easy to become angry ourselves. Similarly, when we're around optimistic, positive people, it rubs off on us as well, and we're more likely to become a more positive person. Smiling helps even if you don't feel like it. There's the old slogan, fake it until you make it, meaning that sometimes we just need to act in a certain way even if it doesn't come naturally. In this example, if you're not feeling very happy when you arrive at your office, try smiling. I know it sounds simple, but sometimes just smiling a bit more can make you feel better, and it will rub off on your staff and on the patients that you meet each day. It sounds a bit hokey, but it actually works. When you smile, all of a sudden you start to feel a little happier and a little more optimistic about things. And that smile will change other people around you. And then when you meet with patients, focus your conversation on what's going well. Congratulate your patients for having exercised 3 times this week. Congratulate your patient on having taken the blood pressure medication you prescribed. Congratulate your patient on having gone for a screening colonoscopy last month. If a patient of yours loses 5 pounds, make a big deal about it. Maybe even drop him or her a note in the mail. A handwritten message can be very powerful and very meaningful to patients. There's so much negativity in the world, and we should do our best to combat all of that with a positive demeanor and an optimistic glow. Be a beacon of hope and inspiration for your patients. Be a comforting place where they can go for wisdom and advice that they know they can trust and in which they can believe. Reinforce the best in life, and you will find that your patients will rise to meet your expectations and strive to do better each day. Patience, perseverance, and positivity are the 3 P attitudes critical to patient care. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice, Positivity. Post your comments and your experiences on the 5 Minute MD Facebook page or on our website, 5minutemd.com. Follow us on Twitter, which is at Brian Morris MD, and you can email me any feedback that you have at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. Let your friends and your colleagues know about this podcast and make sure that you are subscribed on iTunes. Thank you so much for listening. I will see you at the next 5.